Today, we are going to be talking about hypertension, what it is, what it means if you're diagnosed, why it is dangerous, how we measure it, and some tips on how to manage it. Let's get started. This is MedScience Simplified. I'm Dr. Zikky. Now, before we dive into hypertension, let's quickly cover some basic anatomy. Our heart has two ventricles, the left and the right ventricle. Now, the left ventricle is the stronger one. It pumps blood to the rest of the body through arteries. So arteries carry blood away from your heart. When we measure blood pressure, we're looking at the pressure on the arterial wall. There are three main factors influencing this blood pressure: how much blood the heart pumps with each beat, which is the cardiac output, the amount of blood in your body, which is the blood volume, and the resistance in the arteries that the heart has to pump against. How common is high blood pressure? High blood pressure or hypertension is really common and often doesn't have any obvious symptoms, which means that many people who have it don't even know that they have it. In the US alone, hypertension affects 47% of adults, which is about 116 million people. In 2021, high blood pressure caused or contributed to about 700,000 deaths in the US alone. Globally, the World Health Organization estimates that about 1.2 billion people aged between 30 and 79 have hypertension. This is a big problem because untreated high blood pressure can lead to serious complications. How is high blood pressure measured? Blood pressure is the force of blood pushing against the walls of your blood vessels, specifically the arteries. The reading includes two numbers written as a fraction and measured in millimeters of mercury. The top number, or the systolic pressure, measures the pressure when the heart contracts. The bottom number, the diastolic, measures the pressure when the heart relaxes or between beats. Now, your blood pressure changes throughout the day based on what you're doing, how much blood is in your body, and how stiff those blood vessels are. For instance, when you're exercising or feel stressed, your heart beats faster and your blood vessels narrow or vasoconstrict, raising your blood pressure. When you relax, your blood vessels widen or vasodilate and reduce the blood pressure. Healthy blood vessels are elastic, like rubber bands, allowing them to constrict or dilate as needed. Hypertension happens when these vessels become less flexible and more resistant, leading to persistently high blood pressure. Factors that contribute to this include aging, poor diet, smoking, excessive alcohol use, being overweight, inactivity, ethnicity, family history, and certain medical conditions, as well as some medications. Blood pressure is measured using a cuff wrapped around the arm, either manually or using an electronic device. Proper technique is important because incorrect cuff size, not resting before measurement, recent smoking or coffee use, measuring over your clothing can all lead to inaccurately elevated blood pressure. Home blood pressure monitors can help with regular checks. So for consistency, check your blood pressure at the same times each day when you are more relaxed. Normal blood pressure is defined as less than 120 for systolic and 80 for diastolic. Elevated blood pressure is defined as 120 to 129 for systolic and less than 80 for diastolic. Stage 1 hypertension is defined as 130 to 139 for systolic and 80 to 89 for diastolic. Stage 2 hypertension is defined as anything more than 140 for systolic and 90 for diastolic. Systolic blood pressure of 180 and above is considered hypertensive crisis and usually requires immediate medical attention to avoid organ damage. Now, due to the external factors that I mentioned earlier that can falsely elevate your blood pressure, an official diagnosis of hypertension is made after two high readings taken at two different visits to your doctor. If you're diagnosed with hypertension, your doctor may run further tests to identify any risks and the damage done. What does high blood pressure mean? So let's say you or a family member is diagnosed with hypertension. What does that mean and what are the risks? If high blood pressure isn't managed properly, it can damage the walls of blood vessels all over your body, affecting your brain, eyes, lungs, heart, kidneys, and even the reproductive organs. These damaged walls of your blood vessels over time lead to fatty buildups or clots. This is called atherosclerosis, which can narrow or completely block blood flow. This significantly increases your risk for strokes, heart attacks, kidney disease, erectile dysfunction in men, and peripheral vascular disease in the legs. These complications can happen without any preceding symptoms. This is why hypertension is often called the silent killer. Keeping your blood pressure under control can lower your risk of dying by 25% and reduce your chances of having a heart attack or stroke by 30%. Now that's a significant reduction. Managing and treating hypertension. You can control your blood pressure with lifestyle changes and, if needed, medications prescribed by your healthcare provider. The most impactful lifestyle changes are exercising regularly. Aim for moderate intensity exercise like brisk walking for at least 30 minutes most days of the week. Regular physical activity helps lower your blood pressure and improve your overall heart health. Healthy diet. Focus on eating a balanced diet with plenty of fruits, vegetables, whole grains, and lean proteins. Reduce your intake of salt, processed foods, and sugary snacks. Reduce alcohol consumption because excessive alcohol use can raise your blood pressure significantly. Excessive alcohol use is defined as more than 2 drinks per day for men and more than 1 drink per day for women. Quit smoking. Any amount of smoking can increase your blood pressure and harm your heart. Quitting smoking is one of the best things you can do for your cardiovascular health. Now you can watch my separate video of tips on how to quit smoking if you're interested. Monitor your blood pressure. Try to keep track of your blood pressure at home with a reliable monitor. This helps you and your doctor to determine how well those lifestyle modifications are working. When is medication needed? If the lifestyle changes aren't enough, your doctor might prescribe a medication to supplement. Some of these medicines work on your heart to slow down the strength of your heartbeat, or the kidneys to lose more water, reducing your blood volume. Others act directly on the blood vessels, causing them to relax and widen. It is important to take these medications as prescribed and monitor your blood pressure regularly to determine if they are effective. Sometimes your doctor may add more medications acting on different organ systems if one alone is not effective in controlling your blood pressure. Side effects of these medications can vary from person to person, so talk to your doctor if you have any side effects. Important note on prevention. Preventing hypertension is better than treating it later. Regular screenings and early lifestyle changes can make a big difference. If your doctor has prescribed medications for you, please take them as directed to prevent these serious health complications from happening. Open communication with your doctor is very important. Now, to wrap this up, high blood pressure is serious but manageable. By making healthy lifestyle choices and following your treatment plan, you can control your blood pressure and reduce your risk for these serious health complications. I hope this video helps you understand the basics of hypertension and how to prevent and treat it. Hypertension is a complex topic, but I wanted to make sure that I covered just the basics. If you have any questions or need more information, leave a comment in the comment section. Let's talk. Stay healthy, and I'll see you in the next video.